right there.
Oh God, your camera's like. Can I get an apple or something?
It's definitely doing 10 million.
Hi, my name is Dr. Favia Dubyk. I'm a pathologist and a rock climber and cancer survivor. I also love cats, and my Instagram name is Feline Favia. Oh yeah, I was on American Ninja Warrior twice.
All right, so just tell us a little bit about, so you've been having some back issues for a decent while, but they were never like this, right? So there was an accident, you fell. Tell us a little bit about what you used to have happen, you used to get adjusted, you couldn't move your legs, and that would help. Obviously we have an MRI report now, so we know what's structurally going on. Tell us a little bit about how that has impacted your legs, what's helped you, what hasn't, and basically what every type of provider that you've seen so far, both medical and alternative, kind of told you, and what you learned about yourself.
Okay, so it all started back in the 8th grade. I was walking to my science class and I just collapsed. My legs wouldn't work. My mom took me to the orthopedic, and they were like, oh, you need a hip replacement. And I was 13, too young to get a hip replacement, so she took me to a chiropractor who said I had hip subluxation, which is where your hip socket kind of sort of comes out, but not completely. And that required 3 treatments a week from 8th grade all the way through college, because I ran track in high school and I ran track in college. And every time I took a step, it kind of dislocated a little bit. And so Monday, Wednesday, Friday or so, I saw my chiropractor. He just put it back in, and that was my life forever. And then I switched from track to rock climbing, which was a lot easier on my back because it wasn't like a daily force. But there were very large falls, 15-foot falls onto mats, but still a 15-foot fall is still pretty big.
Right.
And when I would take the fall, I would have problems with my hip kind of coming out. And so then I still had to go to the chiropractor to put it back in. But then I found some other treatments like dry needling. Dry needling helped keep my muscles loose because they were kind of getting too tight and kind of keeping the hip out. And so we loosened up all the tight muscles, and that kind of helped my hip stay in. I also learned about prolotherapy, which was a game changer. Pretty much it is some benign liquids like procaine and serapin or glucose, and they inject it into areas, well, various areas actually. So some of them, we put it in my muscles or tendon areas to tighten them, to constrict them so that my hip won't fall out. But I also had cancer, and I have multiple surgical scars, and they contract a lot and cause a lot of chest pain or wherever I have scars. I have a scar here, scar on my leg. So I also get prolotherapy there to break up the scar tissue, and it helps my chest pain or wherever I'm having pain. But this past year, I competed on American Ninja Warrior, and there was a shift from kind of more upper body strength things to parkour. And parkour is not one of my strengths. So I had to do a lot of one-on-one personal training with a parkour expert in town here. And I was jumping up and down, going as far as I possibly could, 3 days a week for about a month. And surprisingly, it didn't really hurt my original hip pain where it would dislocate, but suddenly I had the start of the complete weakness. It was hard to walk. I even fell down the stairs once because I tried to weight myself, and I just went plop, but my parkour skills came in, and then I caught myself. So that happened about 8 or 9 months ago. And it's been a very slow recovery. I got a MRI about 3 months after the weakness because we kind of thought maybe it would get better on its own, and 3 months later it wasn't. And so we found that I had a disc herniation. And so since then, I've been doing a ton of needling, which seems to help, but it doesn't help for long periods of time. So I'll feel better for an hour or two, and then the weakness will come back. And so that's kind of where I'm at now, trying to regain the full strength of my legs.
Doc here has her bachelor's degrees from Harvard, her master's degrees in nutrition from Columbia. She has a medical degree as well, and she's trained to be a pathologist now. So not only is she pushing her body to the limits, but she's working crazy hours right now as well. All the while trying to figure out how to make her body work right, especially coming back from the cancer that she had previously. So yeah, she has a pretty interesting approach, especially given her background in nutrition. So she's a much more holistic person than you'd expect, especially for somebody in the pathology field. But it gives her a lot of insight into a lot of different things. It's kind of cool.
It's the most tender, but
Yeah.
difficult.
So let's go and push straight down there.
Oh, it's not good anymore.
So not a lot of power then. Push the toe up. Try to lift it. Pull, 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 pull. No? Can't do it? Okay.
I don't got anything.
Pull up. Whole foot. So still have that one. Pull up. Just the toe? Just the toe pull up? No? Okay. All right, push down. Does that feel strong?
Yeah.
Yeah. Okay. Let's bring you up here. Go ahead and push down. Push. Push. Can't do it?
No, and I feel it in here.
Okay. What about there? Push. Toes move. Push. Nothing. Okay. Alrighty.
Oh. yo. Oh.
And you can tell your IT bands are. What was your name on the note anymore?
Oh, Dr. Scream.
Just because she's a fan of that one horror movie, I think. That could be the sound effects, either way.
I always thought I could be an opera singer because.
I mean, why not throw it on the list of accolades, right? We wouldn't be one bit surprised.
But
Put us all to shame, making us all feel inferior about our accomplishments.
Do another one.
What else could she do? I don't know.
See, I told people they had to be rougher with me, and they're just not.
Not?
They're not.
You're in the right place. Brandon's gonna make a lot of people cry.
I haven't seen tears yet.
Alright. Gonna push again?
Oh, so much better.
Power back on. Okay, toe up. Yeah. Pull whole foot. Yeah. Solid. So, right there. That's what you gotta do.
Oh God, your camera's like.
You gotta know it's that close. Sorry.
Can I get an anvil or something?
An anvil?
I thought you said apple.
Anvil. Could be an anvil. Well, you know, we have 16,000 deaths a year in incense. The kids can just go to the store and buy. Try to push down.
All those
Found a spot.
layers.
There it is. Hit it in a shortened position. Because the length of the tissue matters. So there's the depth. Get out here. Kind of kicks me out. And of course, if I shorten the lever, it just activates it. Yeah, much stronger.
Yeah.
Big toe up. Yeah, so that's that right there. And like I said, it might be some entrapment upstream, like we've seen on the image, but like a lot of it's happening out here. Push. Push hard. That one's better.
I've been trying to have my friends do this. It's just.
Weaklings. Come on, you gotta use the power.
It's just not the
They don't have
same.
your
Push again.
thumbs.
There.
Much better.
Yeah.
Oh goodness.
Push again. Okay. Yeah.
Better.
Damn IT bands.
clap.
Little snap.
Don't hold back. It's good range. And lung capacity.
Oh!
I found it. It's definitely doing 10 million. So you didn't know this spot was here, huh? You didn't know this spot was here.
I didn't know it at all.
Found it.
Oh, God.
Push again. Nice. Push. That's pretty good.
Better. Much better.
I'm putting your knee pretty high there too. Still getting good engagement on it. Yeah, and then push from there. Yeah, full
Much
power.
better.
Full power there, and pull up. Full power there too.
Whee!
Just gonna give Diego Sanchez a run for his money for the IT band work. It does super suck. It's true.
Woo! Okay.
Wherever the cat is. Next.
It's not really that bad.
Brandon went through it, what, Friday?
Oh, fucking died.
There it is. Why? Did you ask me to do this? I feel like you did.
I look forward to it.
Glutton for punishment.
I don't know what's wrong with me.
Yeah. Interesting. I can see the spot where it's binding up once we get to this height.
You were
That
so
super
close.
high IT band.
I want to grab you.
The ungrabbable.
Okay.
Push again.
Oh, that's even better.
Yeah.
Oh goodness. Okay.
So you meet your husband in medical school, or?
Yeah, I was. Yep.
No, he was in school?
Oh
too?
no, he
Oh, no?
works in finance.
Oh, okay. That's different.
Yeah, I met him when I was sick actually, but I didn't know I was sick.
Huh. He was your financial advisor?
No. No, he's met online.
Oh.
From online dating.
Yeah.
Plenty of fish.
Plenty of fish. I always wonder which ones people use.
Oh, well, I was on 3 different ones.
What were the other two?
OkCupid and Match. Yeah. They all kind of attract different people, so I was really casting a wide net.
So which one? Which people are on what sites?
Well, so
What kind
This-
of people
this is-
generally?
this is also dated because like 8 years ago, 9 years ago
There's
now.
probably different ones now.
Yeah, everything's different. But back then, POF was the first one that came up on the Google search. So if you were inexperienced, you would go there, like quality and inexperienced.
Okay.
But there was a lot of people who sent you just dirty messages, really, really dirty things. But OKC
I know how that goes.
was actually like a Harvard thing. Like one of my stat classes, we actually like did the stats for OKC.
Oh, wow.
And that one had a lot more med students, PhD students, like grad students.
Okay, so it was like an elitist.
What? It was, oh,
He's like, no.
And then match you had to pay for, so it was even more serious people.
Okay. They were there for some business.
Yeah, but the crowd. I was a little young for it.
And push down. There we go.
Better.
Yep.
So when we're here, it feels fine. Like in the middle there, I feel pain here still when it happens.
Push. Okay, right side.
Oh, hold on. I'll try again. There we go. Got it.
Okay. Do the right one again.
Oh, look how much faster that was.
And again. And again. And again. And again. And again. And again. Okay, one time without me. Yeah, not bad. Okay, left side.
Your brother's here.
Yeah. Makes sense. It's a weird day.
Do you want me to have him do anything?
Yeah, roll out of it.
Roll out a little.
Make himself brotherly.
Okay.
Okay, left side up. Okay. Okay, do this one. Go. Okay, here again. And that side again. Okay, right side again. And not bad. Okay, right side again.
Oh.
That was better?
At least the same, but could be better.
Okay, and yep.
Better.
Yeah. How's that pressure on the hip there?
Feels fine.
Push.
I feel it right in here. Not anymore.
Okay. All right, scoot towards me. Okay, let's go there. Bring the heel under all the way.
Under
Yep.
the table like that?
Yep.
Oh.
And then extend it back out.
Mm.
And back under.
Mm.
And back. Keep going.
Mm. 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 Whee! Oh yeah! Oh, a lot better.
Push. Yeah.
Yeah.
Hinges better.
Yeah.
Turns on the corner. All right, back down again.
Oh man. Oh, wee.
Just get the ankle. And not a ton on that one. All right, toes down. And back up. And down. And back up. And down. And back up. And you've had your lower back adjusted at all?
I did on last week.
And it did okay?
Today.
Push the big toe up. Push. Good. And push. Good. Yeah. Push. Yeah. You have to think about it, but it's there.
Yeah, it's not like natural, but
Right. Good. And just the one baby one. Does it usually go more than that?
so yeah.
Yeah. Big toe up. Push down. Push down. Yeah. Same. And push.
That's like the easiest it's ever been.
Yeah, it's actually better.
Yeah.
Push.
Oh, that was harder.
Interesting. How's the hip?
It hurts it there.
Hurts
too.
again?
Yeah. Oh God, yeah.
Yeah, you're locked up over here. Right there. Alright, right there.
Much better.
Yeah. Right there. Yeah, not bad.
Okay.
Was that a painful way?
No, thank goodness.
He did one thing that didn't hurt. So you're gonna go right there. and make a tight fist.
Make a really tight fist.
Yep. I'm gonna try to bend your elbow. And you're gonna
Okay.
try not to let me.
Okay.
So I'm gonna go right there, make a squeeze it really tight, and then I'm gonna go like that. Okay. Now extend your wrist and your fingers back behind my ear. Now stop me.
Okay. So that's just kind of what's happening here.
Yeah. So you're engaging different chains there.
What's engaged.
So
Okay.
you're obviously not actually stronger or weak or any of those positions, but when
Yeah.
you make a fist like that, it preloads your flexor grip here, so then I'm able to break it. When you
Okay.
extend your fingers and your wrist, it preloads your extensor group, so your triceps already re-engaged. So neurogenically, it gives you more power there.
Oh.
So to me, it feels almost like I'm already here on you,
Yeah.
and then you're trying to like get this to work, but I'm already bending it. So it feels like that's what's going on behind the knee.
Okay.
Like there's pressure there already, so now you can't get it to engage because it's already being pressed on.
Okay.
So bring this knee to your chest, and then go back down, and then back up.
Okay.
And down.
I see. Well, it feels better already just walking. Feels pretty good.
Less tight in the front.
Less tight. I still feel a little bit of catching right here, but
Mhm.
because here I don't feel anything. Like it just feels smooth.
Free.
We've tried to needle it, but there's a lot of critical things.
It's not,
So.
it's not a needle area. Femoral triangle. You need to know there's lots of needles in there. It's okay, she's a doctor. If she hurts herself, she can fix it.
One person nicked it once, and I had a nice bruise. Much better. I don't feel it at all.
Alright, let's do one more round of that. So, actually quite more simply just, clearing the fascia where the scar tissue is. Yeah.
I still feel it catching up in here a little bit. Oh, that's the angle that hurts. Like that's actually just pain.
Right. Interesting, though, do you feel stronger there with your calf?
I feel stronger than I did before. Oh yeah, it is stronger.
It's a little stronger there.
Yeah.
It's a straighter line for the nerve.
Oh, that feels better.
Push. Yeah.
Let's see. I feel it catching a little bit again, but now it's gone away. Let me see this one.
That looks good. Remember where it was a few weeks ago? We couldn't even extend back at all.
Yeah, no, it's much better. This one, now it feels fine up here.
And then just walk on your toes. Let's see if you can maintain that power there. Yeah, solid.
Takes me back to my gymnastics days. Oh, I don't got anything.
Okay, like you can't engage your hamstring, you mean?
Mm-mm, yeah.
Pull. Pull.
Better. Oh.
That's a good one.
Oh. I think I'm like a goat or something.
Goat. G-O-A-T.
Better. Wow. Yeah.
It's all popliteus.
Who would think that that would... I mean, he does.
The nerd. There we go.
Much better.
Yeah.
Much better.
Layers and layers and layers.
Yeah.
This head's not as tight though. Nowhere near as tight.
Mm-mm.
Go ahead again. Yeah, it's still holding pretty strong.
Yeah. That's
So
pretty good.
this left side is popliteal. See if that affects there. Yeah, for sure. Push. Oh yeah.
Yeah. Much easier.
Yeah. Feel like a 7-layer dip.
Yeah.
No
Oh, this is like the best it's ever been.
Nice.
Now this side feels not as good.
That's good relatively.
But it still feels fine.
Yeah. And then go up on both toes. The left calf feels stronger now?
Oh, it feels a lot stronger now. Yeah.
Sweet. Alright.
Yay!
Survived again.
Yay!
We were shocked a lot.